culture wars are being fought right here in Canada. Just look at healthcare for trans or non-binary people. Any policy talk quickly becomes polarized, even poisonous. It can be easy to forget we're talking about human beings. Dr. Kate Greenaway has been working in the field for more than 20 years. She tells us how fear factors in. Pierre Poilievre wanted to talk about housing this weekend, but one of the resolutions that was voted on by members would see a Conservative government restrict gender-affirming medical care for transgender youth. I should mention there was another resolution that opposes the inclusion of trans women in women's spaces like sports teams and bathrooms. Is it a good thing in your mind that this is in the spotlight and people are talking about it? Or does your gut sink when you see something like this? Or how do you process it?
Yeah, I would go more with the gut sink. Like, it's a pretty upsetting conversation to listen to, because it's a creation of a culture of fear and discrimination for a group that's already, marginalized and excluded from, lots of employment opportunities, housing and social services and medical services. So really, we're taking a group that we've already pushed to the side of, trans, non-binary, gender diverse people and say, actually, we should probably fear them and discriminate against them further. I think that there are many, many people who get it and who have family members or, themselves are trans or gender diverse, that they sort of experience it in their personal sphere and can put those pieces together. But again, I do think there is a kind of, fear-based rhetoric that people can, get attached to, and I see that happening. And I think there is a difficulty because sometimes there are parts of the media that really like to capitalize on, stirring up that kind of fear and worry. And so we end up seeing a lot of coverage of topics that are just meant to stir those emotions, right? They're not about kind of the day-to-day issues we're seeing for people, trans and non-binary people in our communities. There are these sensational stories that get people worked up and fearful. Gender-affirming care, whether it is psychologically affirming, medically affirming, surgically affirming, is life-saving. That it can take someone from being in a position of great distress and, we mentioned suicidality, to a place of living to their full potential and living their lives. That is why I do this, because it is such a rewarding career.